like, I almost said, did you skip the medicine day at medical school? Like, what are you, like, I don't understand. I don't understand why you think this is, like, not a big deal.
Hey everybody, and welcome to Let's Pod This. My name is Andy Moore, and I'm joined not in studio, but joined via video chat by Dr. Scott Melson. Hello, sir.
What's up, man?
And Bailey Perkins. Hello, ma'am.
Hello, everybody.
Bailey threw the deuce, but you guys can't see that because we're on video chat, and you're not things you wouldn't do in person normally, right? Throw up the...
We're practicing social distancing.
That's right. Yeah, so... This is our first episode since the coronavirus COVID-19 epidemic has truly gripped our country and our state. You guys, man, what a hell of a week. Wednesday night was a doozy.
Yeah, it's, we were talking, before we kind of got started here, probably 10 days ago, I was at two out of 10 on my level of concern.
On the anxiety scale?
Yeah, I've been steadily creeping up, and that's been the case with, most of my colleagues that I talk to in terms of just, man, how bad is this potentially, or, how bad do we think it's going to get? And I think most of us are pretty concerned that at least it could get pretty bad. Hopefully it doesn't. But it could.
Right. Yeah. It's been wild. And even, I've talking to my former colleagues at the infectious diseases clinic at OU. And I know you have as well, Scott, and their level of concern has increased. Right. And what we said last week, I think, was that, it's hard to make an educated decision with inadequate or data, the data we haven't had so far. But now we've got another week's worth of data, and both from the U.S. and from other countries, right? And not just that early data that was bad out of China, but good data out of China. Also, Italy.
South Korea, Japan.
Yeah. And so
and
go ahead.
Andy, you mentioned Wednesday. And the reason Wednesday was a doozy for Oklahomans is because prior to Wednesday, there were no cases of the coronavirus in Oklahoma, at least confirmed cases.
Mm-hmm.
And the NBA was in Oklahoma City. So it was the Jazz versus the Thunder at the Chesapeake Arena.
Mm-hmm.
And one of the players had been exposed to it, but didn't believe that he really had it. But traveled to Oklahoma City before he got to the arena, was tested here in Oklahoma City, and was confirmed to have coronavirus. And then also one of his basketball colleagues has coronavirus as well from being in close contact with him. And so now that has raised the attention for Oklahomans, because that makes 3 cases confirmed so far in our state. One that was first confirmed in Tulsa last week, I believe. And then now 2 here in Oklahoma City.
Yeah.
So.
And what is arguably the worst example of jazz hands I think I've ever seen is when he touched all the microphones
on Monday. So he did a television interview with different reporters and journalists who cover sports for the NBA, and he went through. So Rudy Gobert,
something like that. Yeah.
Went through and touched all of the journalists' microphones and things. In an arrogant way of trying to be funny, saying, I don't have this disease. It's not a big deal.
Right.
Touching the microphones. And then 2 days later, it's confirmed that he does have coronavirus.
Right.
So.
Well, and that's exactly why we are here doing our social distance podcast recording. That's been very effective, I think, at trying to isolate ourselves, but still the show must go on. So I don't know about you guys, but I think, we've seen this week, and as we relate this to politics, I saw yesterday that the U.S. Capitol was closing, the Supreme Court building was closing, the House and Senate office buildings were closing. in Washington as they take precautions, which is smart. I mean, Congress is full of older Americans, which are at higher risk in many ways. And
do we
And
know
from a
off
policy-
the top of our head just what is? So it's the president, then the VP, then the Speaker of the House.
yeah,
No, Secretary of State.
Speaker of the House is third, then
Yeah.
Secretary of State,
yeah,
right?
Mhm.
yeah, yeah.
And then who's next? Because they're all 75.
Mm-hmm. Yeah, it's gonna have to get that chain of succession really lined out here. But here at the state level, so we had a couple of, obviously press conferences this week following the Thunder deal and the NBA canceling their season. There's a press conference I know we've seen from Governor Stitt and Lieutenant Governor Pinnell and Oklahoma City Mayor Holt. Everyone's kind of posted on social media about the response. Commissioner Gary Cox, and it sounds like, and I think this is the case everywhere, right? That Oklahoma, as of right now, doesn't have as many tests as we would like to have. The other day, Commissioner Cox said they had the capacity at that time for about 300 tests, but more supplies were arriving every day. And I think today we've seen a lot of reports on social media, for what that's worth, of people who felt like they needed to get tested, but weren't sure if they would meet the eligibility criteria or the guidelines from the Department of Health. And so it sounds like testing has not been widely rolled out in our state yet.
Yeah.
Well, and there's been a lot of rising, how do I phrase it? I think the administration and our federal leaders are really starting to take this more seriously.
Yeah.
It was announced earlier that the president was going to declare a state of emergency to be able to activate the funds that they passed. I believe they passed about $8.9 billion more in funding to be able to get down to states and local governments to be able to do more control over getting testing out, helping health providers in building this infrastructure to better be prepared for this pandemic. I'm sorry.
Yeah.
So we'll see what happens when those funds trickle down to see if that leads to more testing, more efficient capabilities to be able to know. Because there's a lot, like you mentioned on social media, there's just a lot of conversation about, are there cases? Are there not cases? What's the official test? Where they are? And so this will help to get more structure to be able to help mitigate the risks that we're expecting.
Yeah. So I think it's safe to say that Oklahoma is basically shut down. Most of America is, right? Like the events we've seen that have been canceled already. And I'll say now, we were in the midst of planning our Let's Fix This Capitol Day for this year. We're going to have only one because of the reconstruction at the Capitol. It was going to be April 1st, but we made the call yesterday. Like, you know what? Let's go ahead and cancel it. We don't want folks feeling compelled to get out when they shouldn't. And even if we kept it going on, I think it would be very poorly attended for everyone else who had the right idea to stay home and to try to just ride this out. The more that we do that, the more that we isolate and quarantine ourselves. Like Scott coughs in the middle of this. I've
been coughing for the last month. I've been coughing.
It's
I've been coughing
allergies.
ever since I had the flu. It really is. It really is, though.
It is unfortunate that this happens in the middle of Oklahoma's peak allergy season. Also, at the end of flu season, there's lots of agents in the air that are affecting everyone. So anyway, so our Capitol Day is canceled, and I think pretty much every other event in the state has been canceled. Bailey, do you want to speak to anything that the food bank is canceling, doing or not doing that's in response to this?
So Oklahoma Food Bank, Regional Food Bank of Oklahoma particularly, is shutting down the volunteer center after Saturday, just to monitor what's going on. The organization is fighting hard to balance the safety of our staff and volunteers while being sure that we can be available to meet need in the community. We know that with the growing concern with the coronavirus pandemic, that means there's going to be more demand for the services that our partners provide across the state. And our partners rely on us to get that food to them to be able to take care of families in need. And so we are day by day thinking through what needs to happen for us to be able to continue distribution, but also keep our staff safe. So there's some internal practices that we are putting in place. So we're encouraging staff to practice the social distancing, not be in spaces and meetings that have more than 7 people and things, just to make sure that our staff is healthy and safe, because we won't be able to do our jobs if staff aren't healthy. And so that's what we have so far on the website, rfbo.org, or if you live on the eastern part of the state, okfoodbank.org. There's a list of our partner agencies that are on those websites to where people can find out where they can go should they need food. One of the great things, because I get the question often, is what's going to happen to kids should school shut down, because many of them are going to spring break early.
Yeah.
The great thing is that the Oklahoma State Department of Education has applied for several waivers that would allow the state to be able to still serve kids and do it in a more targeted way to make sure that no kid goes hungry during this time where there's no school. Because we know that many of our children depend on that meal that they get for breakfast and lunch at school. And so there's some opportunities once those waivers are approved for schools to still be able to get food to kids, even though schools are out.
Right.
Yeah, I think the only, I would tag team on that and say that I can't emphasize enough how important it is that people take this seriously. I'm not seeing a ton of folks on, social media or, in my kind of personal spheres of people saying like, oh, this is just an overreaction. This isn't a big deal. Still a little bit, but not nearly as much as probably, maybe 10 days ago. But it isn't, we're seeing like, meme accounts that are doing, making jokes about social distancing. No one's saying like not to do it, but you're seeing people kind of, like put, wearing like these suits that they've made that, have arms sticking out in all directions.
Right.
And those things, those are funny, but like it cannot be overstated. Like social distancing, keeping yourself away from other people to the extent that you can, just you, your family, whatever that looks like for you, that is really something that has the potential to save lives. And it's really the best hope that we have at this point to try and slow, not stop. We've passed the point of stop, but slow the spread of what is a pandemic disease. The situation, we were talking before the podcast, and Bailey, you told me I should say this on the show, so the American Hospital Association is telling hospitals and healthcare providers that we should be prepared for or, anticipate something on the order of about 96 to 98 million infections in the United States. One, that's just a lot of people. Now, as we've talked about before, it is still true that most people who get this disease will probably be only mildly ill. Mm-hmm. Most people, meaning, 80% of people will be only mildly ill. Let's say that 5% of people who get the disease have to go in the hospital, okay? That's 5% of 96 million is what? About 4.8 million people that need to be in the hospital. Well, as of today, according to the American Hospital Association, the total number of staffed hospital beds in the United States is 924,107. So it's 924,107 hospital beds for about 4.8 million people who need them.
And that's just related to coronavirus, not any other...
Not anything else. And then not only that, but on any given day, only about 35% of those beds are available, right? Because they have patients in them with other things. So that's, roughly speaking, about 325,000 hospital beds. available for a coming slew of 5 million people
Right.
with coronavirus. Of those 5 million people, probably about 1 million are going to need intensive care beds. As of today, intensive care beds are 97,776. So that's about 100,000 ICU beds for 1 million patients that will need them.
Yikes.
So,
Wow.
and then if you if you factor in a case fatality rate of 0.5%, which seems potentially even a little bit optimistic, honestly, a case fatality rate of 0.5% would lead to about 475,000 deaths. So one way to think about this is what we're looking at is maybe about 100 people who get sick, but of that, roughly 5 million, or slightly more than the population of Oklahoma, will be sick enough that they have to be in the hospital.
Huh.
Of those 5 million, about 1 million will probably need an ICU bed, roughly the population of Oklahoma City Metro. Imagine the entire Oklahoma City Metro needing to be in an intensive care unit.
Yeah.
And about 480,000, or about half of those people, at serious risk of death.
Wow.
Like, those are the numbers that we're talking about. And because we don't have testing capacity, which is an extraordinary policy failure, but that's another discussion for another time. Because we don't have testing capacity, we can't identify like hotspots where new infections are coming up, right? It's really tough to isolate. So we have to try and slow the spread of the disease by isolating everyone, essentially. Like, everyone has to stay kind of within their little circle of life and not do anything that's not really necessary. And that's not going to stop this from going through the country, but the hope is to slow it down so that all 5 million of those people don't show up at the hospital on the same day.
Right. Right.
And this, by the way, is not theoretical. I'm not gonna try and terrify people by just sitting here and reading the Twitter feeds of intensive care doctors that are working in Italy. But if you've seen any of those reports, it's bad, guys. Like, it's real bad. And we're starting to see some real bad cases in Seattle, where the disease has been in the community for at least the last 6 to 8 weeks. So I think that there's reason for optimism. I think that we might have a higher degree of immunity in the communities than we think, because the disease, I think, has clearly been circulating for several weeks. But if you're waiting for a moment to kind of like break the glass and take some serious steps, I would say we're probably at the break the glass moment. Like, the cancellations, the staying home, these things are completely appropriate.
Right.
And that's all the doctors, for the most part, that I have spoken to about this are in agreement.
Well, and that's the whole thing, right? Like, we've all, by this point, I think we've all seen the chart on social media about how to
Flatten the curve.
Right? And so I think that is really helpful, and I think illustrates that there's going to be X number of infections in the country, right? We can try to minimize that, but there's still going to be a lot of infections, and
It's going to happen.
And it's going to happen. It is in your communities everywhere now, and it's going to happen. So you can minimize your risk, right? And you can try to keep yourself safe and healthy, and other people, right? So even if you don't get, critically ill, you could still be carrying it around, right? And this is why, many communities, Los Angeles, in fact, today canceled all the public schools, because even though kids are like lower at risk for death and severe things, we all know they're little vectors running around, right? And so they're at grandma's house. They get it from Billy, gets it from his parents, and then he goes to Johnny's house, and then Johnny takes it home, and his grandma's there, and then grandma's in the hospital, right? That's how it can travel. Yeah. Not by any fault of anybody, but that's just what happens. And and so taking those steps is how we mitigate the spread, canceling things, how we mitigate the spread, and also how we slow the spread so that we don't overpower the healthcare system, and we give a chance for people to get into the hospital, get treated, get out of the hospital, and make room for somebody else, rather than everybody surging all at once.
Well, and I'm also glad that, Scott, you mentioned briefly the importance of policy decisions, because what we do in policy helps us prepare for these moments that are inevitable. So there are always moments when different challenges that are coming our way, whether it's for like weather related emergencies or public health related, emergencies, we're having the infrastructure to help people in these moments. So I'm thinking about Medicaid expansion. With the passage of that for the future, we'll have more people who have the opportunity to be covered. We'll have the growth of more hospitals developing to be in communities, to be available, to have more beds for folks in these moments. There's conversation about the need for paid sick leave and paid family leave, because there's a lot of people in this pandemic who don't have the ability to be able to take off work and do that social distancing, because they could lose their jobs and not be able to provide for their families. And even businesses are trying to have the conversation. I was talking to someone yesterday about the concerns about how do you work with temp workers and hourly workers, and being able to document, their work, but also giving them that time, even though it's a big challenge right now. So it's important that thinking about this in a systemic way and in a policy level helps us to prepare in the future, so we don't feel like we have to panic, and we have the systems in place to be able to protect people in a large way.
Right. And I will say, as we are recording this on Friday afternoon, the president is speaking right now and has just declared a national emergency.
Absolutely.
And, which I think, kind of expected, right? But and we're a little surprised it took this long. So let me get my words here. As is the case with other emergencies like this, the declaration is not just symbolic, like it actually signifies that by doing that, it means that certain rules can be relaxed, and it gives agencies some flexibility to respond in ways that they might not otherwise be authorized to do, right? And so we can move a little quicker. And I think a lot of folks will say that this is late coming. Apparently, they are also giving $40 billion in emergency funding to help have this come out. Well, one reporter said 40 billion. Another reporter said 50 billion. It's a lot of billions. And so anyway, getting that out there, that this allows states then to respond. It also frees up money for the states to do things like buy more tests and maybe relax the rules for their Medicaid program to ensure that more people will get covered so they can get tested, all these things.
So the emergency declaration will free up Medicaid funds? Because previously the administration, there was a headline that, in the LA Times today saying that they were blocking it, which is not really what's happening. They just hadn't proactively reduced the rules the way that the Obama administration and the Bush administration had in previous national disasters. So will declaring this emergency, will that free up those Medicaid dollars to be used more flexibly? That's
my understanding based on what I've read so far. But I mean, this is literally, it is 2:35 p.m. right now as he's speaking. And it appears the president does not have a teleprompter. And so he's kind of trying to find his words as well. And that's, I think, leading to some confusion among reporters that are watching it and trying to tweet it.
That's crazy.
Well, there's been a lot of with him. There is a lot of growing pressure from governors and mayors, particularly of larger cities, adding that level of pressure to the president to make this announcement, because many communities have already declared states of emergency so that they're able to accept those funds and move quickly with this pandemic. And so I'm glad to see that the president is responding accordingly, and now states can really get to work in the way that they need to.
Has the state of Oklahoma already declared an emergency? Has Governor Stitt said that? Or do we expect that to come now?
I think that'll be coming. It hasn't happened yet. I believe Dallas County did last night in Texas at 10 o'clock. They had their first case of what appears to be community transmission, meaning this is someone who tested positive for the disease that did not have any known risk factors.
Right. Someone who didn't visit Italy or China or somewhere recently or have direct contact. Yeah.
Which that's an important thing to put at this point. I think at this point, if you've been to an area that's known to be endemic, that's important. But as of right now, according to the CDC website, 46, I think, out of 50 states have documented cases. But literally right before we started recording, I was on a conference call for healthcare providers in the hospital folks with the CDC, and they actually used the figure 49 out of 50. So I don't know if the website, if there's been some more presumptive positives since noon, which is when they update the website, but we know it's in Oklahoma. We have a positive test in Tulsa from someone that traveled to Italy. We know it's in Oklahoma City because of the NBA players that were here. But I think everyone should assume that this virus is out and about in their communities to some degree.
Yeah. So, man, we could talk about coronavirus and COVID-19 probably all day. However, the entire rest of the world is talking about it all day. So maybe let's give our listeners a bit of reprieve and talk about something else. Did
the legislature meet this week?
Yeah. It was the deadline week.
It was a deadline week, and they ended early. They stayed late last night to get done. Was it last night?
The House even finished business on Wednesday.
That's right. They were,
and then the Senate had business on Thursday,
which is not uncommon, right? Next week's spring break, and they usually try to wrap up early before spring break because some of them like to travel with their children. Speaking of children.
Some stuff of consequence that was passed this week.
Indeed, sure. Yeah. Speaking of children, let's talk about child marriages. So there's hundreds of bills that went through this week, and we can never cover all of them. But I think we try to highlight ones that have entered into the public discourse in a way that is important or unexpected. And this one, to me, came out of nowhere. I know we had Representative Dunnington on the show a few weeks ago. I don't recall if he mentioned this or not. But this bill really kind of caught fire, was on the news, and a lot of folks are talking about it. It would basically, I don't even know all the details, but it was Representative Dunnington's bill that would make some changes to the law that apparently our law allows for people under the age of 18 to get married if their parents tell them it's okay or make them do it. Is that your understanding?
So 16, 17-year-olds could get married with parental consent.
But not 15 or younger?
Yeah, not 15 or younger. So this was, I think, a vestige of the so-called shotgun wedding.
Right.
So oftentimes, I think these are girls and their, whatever the relationship is between these teenage girls and the gentleman that's in question. Somebody ended up pregnant, and the thought process was that the best thing is for them to get married. And I think this is, Representative Dunnington, this was brought to his attention. I think this might have been brought to his attention by some constituents, actually. This is still happening in Oklahoma with an estimated 2,000 child marriages per year.
Wow.
And especially from that lens, we have a high teen pregnancy rate statewide. And so that would make sense that mentality is still there.
Yeah, one of the highest teen pregnancy rates in the country.
Yeah.
Top 10 state.
That's where... That's funny. So that's where the bill originated, I believe. This would essentially, I haven't looked at the text in a minute, but I think there've been some changes. But I think it just said it essentially means that under 18, you can't get married. Your parents can't marry somebody off when they're under the age of 18. There was initially some opposition to this from some other legislators who felt like it was taking away parents' rights, because parents always know, they're like, the parent knows what's best for their kid. I'm like, I'm just sorry, I just can't. I don't even know what to do with it.
I have two daughters, and I would prefer they wait till they're 35. I think just.
And awkwardly, this bill failed the first time.
Right. Yeah. It
did. Now the second time it passed, I want to say 72 votes off the floor.
Yeah. So it failed, but there's a parliamentary procedure that Dunnington used where he said he wanted to have it
move to reconsider,
right? And so they let him do that, and so which means he could bring it up again. He brought it up later in the week, I think on Thursday, after having talked to some folks and made a couple of amendments that appeased everybody. But still, it wasn't unanimous. I mean, 70 is pretty close, but so it passed on the second passage.
Right. I mean, it's one of those things that you're just, really, this is where we are?
Well, and I think, another important connector to this discussion, it was brought up by a friend of the pod, Effie Craven, about the relatively high rate of young women in the sex trade in Oklahoma, right? And that this often, sometimes, women under the age of 18 are forced into marriage as a guise to obscure or to hide the fact that they're actually sex slaves, right? And then involved in that. And so this would help, presumably, to curb that. And I think anything that shines light on, just, really terrible issues like that people don't want to think about, we got to think about it, and you got to find ways to fix it. And this, I think, is a step towards that.
Absolutely. Well, and on a positive note of what came out of the legislature this week, our state employees have been fighting a long time to have a cost of living adjustment applied to their pensions. One of the challenges with that is that many retirees have had flat income, essentially, when it's time for them to get money from their pension. And so their dollar is not going further because the funding has been stagnant as inflation continues. And so the legislature, in a bipartisan way, made it happen for our state employees. And so now they'll get a percentage increase to make their dollar go further over time.
Right.
Is this, Billy, do you know, is this catching them up? Or is this just they'll get a COLA going forward? Or is this like going back 10 years or whatever since they had one? Like, will this catch them up for all the years they've missed? Or is this just going to bring them, like, starting next year, they'll get one for whatever the COLA was this year?
I believe this puts the COLA in place. I'll have to do more digging to see if it is retroactive to catch them up. But I know for sure that going forward, the COLA will be put in place.
Another bill that we talked about last week as well that passed out of the House with an amendment was House Joint Resolution 1027, right? So this is the bill we discussed last week, I think at length, that would make some pretty significant changes to the initiative petition process. It did two main things. One, it changed the number of signatures required. It was originally going to be, or it originally is, a percentage of the turnout in the previous gubernatorial election, and it was going to dramatically increase that. And then the second thing it did was require signatures to be gathered as evenly divided out among the state's congressional districts. So they amended it this week to pull out that numerical change, and so it passed off the floor. And basically, it would just require that the number of signatures gathered are evenly distributed among the state's congressional districts. We've seen other states pass similar legislation. However, I was, I will say, impressed and maybe relieved, but a little bit surprised at the public pushback on this. There were a number of editorials written around the paper, the Oklahoman, the Tahlequah paper, the McAllister paper, the Woodward paper. It really was across the state of people saying, hey, this is another example of these guys trying to quiet your voice.
Yeah, we've had the speaker, the pro tem of the Senate, Senator Treat, in response to the initiative petition to end partisan gerrymandering, said this was a power grab by out-of-state liberals. You want to talk about a power grab? This change that they're wanting to make to the initiative petition process to try and stop citizens from being able to amend the Constitution or change the law when the legislature won't do it. It's just I get my dander up about this one sometimes.
Mm-hmm. Yeah, it's a big deal. I think it's odd, and we may have talked about this last week, but I'm going to reiterate it just in case. So if it passes out of the Senate, and I think we fully expect that it will, right? It'll go on the ballot, and it'll be up to the governor for which ballot. And the timing varies here depending when it passes the Senate. When the governor signs it it potentially could go on the June state primary, or it could go on the November general election. But either way, there's a chance it is on the ballot along with other state questions. And so potentially this is a bill that could drive turnout of people that are opposed to it, who might not always support things that the majority party wants, right? And so it could, right. I think there's a way this backfires on the legislature in a way.
Well, and I mean, it's another reminder for our listeners that this is something that needs to go through the Senate side as well in the way that it went through the House side. Mm-hmm. And so there's still opportunity for our listeners to reach out to their senators about this particular tool being taken out of the toolbox for citizens to get engaged with their government.
Yeah, it'll be really interesting. All right, well, and
I want to mention one other positive bill that came out of the legislature. Representative A.J. Pittman got a bill off of the floor that was focused on infant and maternal mortality. For women in America, they die more frequently than women in other countries at childbirth. For Black women in particularly, regardless of income levels and regardless of other health factors, they're 4 times more likely to die at childbirth than any other group of women. And so this issue is something, especially as a 30-year-old Black woman, it's something that's near and dear to my heart. And so one piece that Representative Pittman was getting to in her legislation was getting at implicit bias that happens in the healthcare sector. Even me personally, I've experienced doctors not taking my concerns seriously. And it happens often. And so this bill would require implicit bias training for different health professionals. And it did pass the House floor. And so that's a huge positive to ensure that more people are getting adequate care.
Yeah,
when they go to the doctor. So
I have a question, Bailey. Do you know there was a couple days ago, I'll have to go back and find it. Somebody on Twitter, and I think it was after this bill passed, somebody on Twitter said, man, a lot of members of hashtag OKLedge either don't know what implicit bias is or strongly bristle at the suggestion that they might suffer from it. Were there some fireworks on the floor when this was being debated? Any idea what that's talking about?
That's what I hear. And sometimes implicit bias in those conversations are misconstrued as someone calling somebody a racist, or the term political correctness, right? And so there's a lot of misunderstandings about how to address the issue because it was assumed to be a racialized thing, when the reality is it's about how do we ensure that all perspectives are considered and that we're giving everyone equitable treatment and consideration, especially when it comes to the health of women. We see a lot of, when it comes to misdiagnosis and maltreatment that happens to women of color and people of color in general more frequently than other groups. And a lot of it is because a lot of concerns that are brought up are sometimes ignored. And so this ensures that we're thinking about where our blind spots are when we're talking to people, and that we're having a cultural competent lens applied to how we're giving services to different groups. And so I think there just was some misunderstanding about that from many lawmakers. But I think Representative Pittman made a great case and perspective, and that showed by the legislation passing on the House floor.
That's outstanding.
Yeah, it was a good bill. So the next stage in the legislative session this year, next week, are they meeting? Are they not for spring break? I feel like they're taking a break. They usually take a break for spring break.
I mean, I'm not going to be shocked if they take a break while we figure out
coronavirus.
See what the virus situation is.
Well, and that's, I mean, I'm going to, put out a video for the People Not Politicians campaign, but I'll say it here because I know there's some crossover in listeners. Tuesday is supposed to be our hearing before a referee of the Supreme Court. It was going to be an in-person thing at the Judicial Center. Yesterday, they called and said it's going to be a conference call, basically, telephonic instead. And so it shouldn't last that long, and I'll try to live tweet it or something, but we will put out the information about that afterwards. So it's not an in-person thing. We were going to rally folks at the Supreme Court building. That is off. Everyone stay home, wash your hands, and try to stay healthy for a little while and let all this blow over. So, and I think we're going to see that a lot. I think this really does have an impact, and maybe we can end on this, but there are a number of state questions. 810, mine, 807 as well, one of the recreational marijuana ones, and any others that may still get filed. 809, the permitless carry related bill that have yet to collect signatures, right? And so having this virus floating around and the cancellation of all these events and our legitimate concern about the public health really may have an impact on the ballot process in a way that was not anticipated when we initially filed this measure back in October, right? And so I think it's interesting when you see a microscopic virus directly affecting people's pocketbooks, our democratic processes, all these things. We realize how interconnected
our economy.
Yeah, and the economy, exactly right. So what a time to be alive.
I mean, it is interesting as you watch, as we see, leaders at the state level, leaders at the federal level, as we're debating over policy responses. I listen to. I think I say it on the show all the time. I'm a progressive. I'm not shy about that. We try to provide both. We try to be nonpartisan here
except for you.
And on the I think we represent both sides of the issue.
There were several times this week that you said, I think this is a Republican position that I'm on board with.
It's true. It happens frequently actually. Mm-hmm. But I listen to Pod Save America, which is several speechwriters from the Obama administration. They are not nonpartisan. They are, in fact, 100% partisan, and they would say that. But they put this, I think, really well. Coronavirus doesn't care what party you are. It doesn't care who you voted for. It doesn't care how really. I mean, I guess in some ways it cares how old you are, but this is not something that you can pundit away, mm-hmm. right? You can't hold a rally and say it's not going to affect you. You can't say it's a hoax. You can't say this is here and it's real. And I think it's an opportunity that it's something that's going to be very, very potentially trying for the country, but it's an opportunity that I hope we can use to come together and try to do some good things.
I agree. I think it'll be interesting to see in future years if this has any impact, if this is a thing that cuts across our country enough that it affects our vaccine policy and some of those things in our state and our country. So, all right, well, that brings us to the end of the episode. Bailey, thank you very much. Scott, thanks.
Absolutely, thank you.
Thanks for being here.
Always a pleasure.
Thanks for joining via FaceTime. Listeners, thank you for being here. I hope you are secure in your viral-free bunker or that you are recovering well. If you did get sick, please remember that Let's Fix This is a nonpartisan, non-profit organization who strives to educate and equip Oklahomans to be more engaged with their government. You can still do that from the comfort of your home. You can do it online. You can do it in email. You can make phone calls. Just because you got to stay home doesn't mean you can't be involved. Take this time to read a book, read some of the resources on our website, get up to date on the policies that matter to you, and make a plan for how to be involved in the coming weeks. As far as we go, the show is produced by me, Scott Bailey, You can follow us on social media. Scott is at SC Melson. Bailey is at Bailey M. Perkins, and I am at Andy OKC. Follow Let's Fix This at Let's Fix This OK on Twitter, Facebook, Instagram, all of those things. Like our page, share the podcast with friends. Let them know this is a great resource. And feel free to rate us on Apple Podcasts as well, because that helps other folks find it. And with that, I guess everyone go wash your hands and have a good week.